Summary: Stop Overthinking, Nick Trenton. Book link. Click here. Here is a summary of the book. Overthinking is an excessive and intrusive mental activity that causes distress. It involves obsessive worry, rumination, and negative self-talk. The causes of overthinking are anxiety and stress, not the subjects of the thoughts themselves. Overthinking is a result, not the root cause, of fear. Several potential causes of anxiety can lead to overthinking. Genetics. Anxiety disorders tend to run in families, suggesting a genetic component. However, environment and experiences also play a role. Environment: traumatic experiences, health issues, financial problems, work stress, and relationship difficulties can trigger anxiety and overthinking. However, not everyone who experiences these stressors becomes an overthinker. Mental habits. Overthinking can become a habit through conditioning and negative self-talk. Breaking this habit requires conscious effort and practice. Lack of purpose. The mind tends to wander and contemplate without purpose or meaning. Having purpose and direction can help combat overthinking. Lack of self-awareness. Understanding your tendencies, triggers, and cognitive distortions can help you gain awareness of your thoughts and avoid unhealthy mental spirals. Developing emotional intelligence and mindfulness are helpful for this. The consequences of overthinking include stress, sleep problems, health issues, relationship difficulties, and decreased productivity and enjoyment. There are many strategies and techniques to overcome overthinking, including limiting input, time management, relaxation techniques, cognitive reframing, setting a purpose, and self-awareness practices. The key is making a consistent effort to change unhealthy mental habits. That's a high-level summary of the key points and concepts discussed in the book. Please let me know if you would like me to explain anything in the summary in more detail. A study found that chromosome 9 carries genes associated with anxiety disorders. However, genes alone do not definitively cause anxiety. They only explain 26% of the variability in whether someone develops an anxiety disorder. The environment, life experiences, and lifestyle account for the remaining 74% of the influence over anxiety. It can be hard to separate genetic and environmental factors, especially when parents pass down both genes and parenting styles. Having a parent with anxiety increases the chance of a child having anxiety, but it is not inevitable. Genetics do not doom someone to a fixed fate. As people age, environments and experiences have a more significant impact than genes. Anxiety can be managed through effort and awareness. Overthinking is partly genetic but primarily influenced by environment and habits. Anxiety feeds on negative thoughts and triggers like insecurities, health worries, and relationship issues. Suppressing anxious thoughts often makes them worse. Daily routines like social media use, diet, sleep, and exercise can worsen overthinking. The environment, especially stressful life events, plays the most significant role in anxiety. While some stress is good, too much depletes resources and the ability to cope. Chronic stress combined with biological vulnerability causes anxiety and burnout. Significant causes of stress and anxiety include work, relationships, finances, health issues, trauma, and cluttered/unpleasant environments. Our mental frameworks and behaviors are also very influential. How we think about and react to anxiety-inducing situations determines their impact. Examining how nature, nurture, thoughts, and actions interact gives us more control over anxiety. Effort and awareness can moderate the effects of genes and the environment. Our load of stress depends on how we carry it. Anxiety develops from genetic vulnerability, environmental stressors, and unhealthy mental and behavioral patterns. While we cannot change our genes, we can work to improve environments, thoughts, and habits. This approach gives us more influence over anxiety and the ability to live well despite it. Overthinking and anxiety are primarily determined by your perception and interpretation of events, not the events themselves. How you think about and engage with stressful situations shapes your experience. Overthinking has many negative consequences, including physical, mental, and social harm. Overthinking can become a vicious cycle that feels hard to escape. To overcome overthinking, the first step is developing awareness of yourself, your triggers, and your patterns. Understanding means observing yourself without judgment. You can cultivate awareness by checking in with yourself, maintaining a healthy lifestyle, and practicing mindfulness. The 4A's technique offers strategies for managing stress and overthinking. Avoid. Remove yourself from the stressful situation when possible. Take a walk or do an enjoyable activity to shift your mindset. Alter. Change the way you think about the stressor. Try to reframe your perspective to be more balanced and less catastrophic. Accept. Practice acceptance of what you cannot change. While this is complex, accepting reality can help reduce anxiety and make the situation more manageable. Adapt. Take pragmatic steps to solve problems and cope with challenges. Focus on what is within your control and plan to move forward healthily. Overall, the key to overcoming overthinking and anxiety is gaining awareness and insight into yourself, challenging unhealthy thoughts, accepting what you cannot control, and taking action on what you can influence. With regular practice of these techniques, overthinking can become more manageable. There are 4 main ways to respond to stress. Avoid the stressor when possible. You can avoid stressful people, environments, tasks, etc. Say no to things that drain your time and energy. Alter the situation. Ask others to change their behavior, set boundaries, negotiate, and communicate your needs. Make the unavoidable stressors more manageable by breaking them into smaller chunks. Accept what you cannot change. Validate your feelings, and forgive others if needed. Shift your perspective to a more balanced and optimistic one. You can accept a situation without liking it. Adapt to the stress. Make lasting changes to how you view situations and yourself. Build resilience by focusing on what you can control and influence. Change negative thought patterns to more empowering ones. Some concrete techniques for managing stress include keeping a stress diary to identify triggers, reactions, and effective coping strategies. Record your stress levels, events, thoughts, and responses. Look for patterns. Practicing mindfulness, gratitude, and self-care. These help build awareness and resilience in the face of stress. The key is to practice awareness of your stress levels and reactions, then consciously choose how best to respond based on the 4 options: avoid, alter, accept, or adapt. With regular practice of effective stress management techniques, you can gain more control over your anxiety and stress. Keep a stress diary to analyze the causes and patterns of your stress. Look for common triggers, events that cause stress, how those events impact your productivity, your typical emotional/behavioral responses. A sustainable level of stress. Analyzing the diary can help you gain insights and make changes. You can then use techniques like the 4s to take action. Journaling in various ways can help relieve stress, gain self-knowledge, work through problems, and stay organized. Options include gratitude journaling, listing things you're thankful for, daily emotional release, dumping feelings onto the page, bullet journaling, brief notes to track goals, priorities, and memories. The 5-4-3-2-1 grounding technique uses your senses to bring your focus into the present moment and halt rumination. It works by finding 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, 1 thing you can taste. Narrative therapy focuses on the stories we tell about our lives. Externalization separates you from your problems, seeing them as something you have, not something you are. This helps you feel more in control and able to reframe your experiences. Ask yourself what genre or role you play in the story of your life. See how those frames influence your experience, and empower yourself to change them. Put distance between yourself and your challenges to gain perspective. Anxiety and overthinking often stem from poor time management and feeling overwhelmed by responsibilities. The 4 A's of stress management are avoid, alter, accept, and adapt. We can avoid stressors, alter our environment, accept what we can't change, and adapt to cope with unavoidable stress. Journaling helps organize swirling thoughts and evaluate their merit. The 5-4-3-2-1 technique engages the senses to reduce panic and overthinking. Prioritizing rest, relationships, and enjoyment is vital to managing time and reducing stress. Schedule leisure time and take breaks. See these as equally important as work. Have a positive mindset that values your well-being. Do things just because they make you happy and nurture good feelings. Take care of your social, emotional, and spiritual health as much as your physical health. If your schedule doesn't allow time for the essential things, it may be wrong for you. Time management should support what matters in life. Structure your life around your priorities and values. Observe how you currently spend your time and make adjustments to better align your time usage with what matters most to you. Define your priorities and rank your daily tasks by urgency and importance. Focus on your preferences and essential tasks first. Delegate or minimize unimportant tasks. Have a schedule, to-do list, or calendar to keep you on track. Break big tasks into smaller steps. Focus on process over outcome. Learn to say no. Different time management styles require different techniques. Determine whether you are a time martyr, procrastinator, distractor, underestimator, firefighter, or perfectionist, and use strategies tailored to your tendencies. Allen's input processing technique helps you minimize distraction and wasted time/energy. Observe your inputs and quickly determine whether or not they require action. Either act immediately, schedules the activity for later, delegate, or ignore the information. Be consistent in addressing inputs promptly. Streamline your life by reducing accumulated tasks and open loops in your mind. Make prompt decisions about inputs and follow through. Stay on top of things to avoid feeling overwhelmed. The goal is to feel more in control and less stressed by minimizing overthinking and distraction. Consistently address issues promptly and clear your space of accumulated tasks demanding your mental energy. Here's a summary. Busy people can inadvertently do more work for themselves by procrastinating on essential tasks until they become urgent. This causes unnecessary stress. Time management refers to prioritizing what's important and letting that guide your actions. The Eisenhower matrix helps with this by categorizing tasks as follows: important and urgent, do immediately important but not urgent, schedule to do not essential but urgent, delegate or reschedule not important and not urgent, delete. Set SMART goals to give clarity and focus. SMART stands for S, specific, M, measurable, and attainable, R, relevant, time-bound. The Kanban method helps streamline existing systems and processes through minor, constant improvements. The core principles are: start with what you're already doing, make incremental improvements, respect current rules. At first, encourage leadership when possible, use 6 actions to improve workflow. Visualize your workflow, avoid having too many things in progress at once, manage the flow of your time and energy, limit work in progress, measure and optimize the flow, make workflow policies explicit. Improving time management is critical to reducing anxiety and overthinking. Poor time management leads to feeling overwhelmed and stressed. Techniques like making to-do lists, prioritizing tasks, breaking down goals, and Allen's method can help you manage your time better. SMART goals are specific, measurable, attainable, relevant, and time-bound. They help give you concrete targets to work toward. Relaxation techniques are essential to practice regularly to lower anxiety. Some options include autogenic training, combining breathing, visualization, and body awareness to calm yourself. It works by inducing a relaxed state. Progressive muscle relaxation, systematically tensing and relaxing different muscle groups in the body individually. This releases tension and calms the mind and body. Visualization, using mental imagery to imagine a calming, peaceful scene. This can shift your mind from anxious thoughts to a relaxed state. These techniques can be used regularly as a preventative measure and as needed when anxiety arises. Relaxation is a skill that requires practice. The key to all these techniques is focusing your awareness on your body in the present moment rather than anxious thoughts. This helps to induce a calm, relaxed state. Autogenic training is a technique developed in the 1930s by Johannes Schultz involving a series of relaxation exercises. It focuses on different body parts while repeating comforting phrases like "my arms are heavy" or "my body is warm." Regular practice of autogenic training can help reduce anxiety and promote relaxation. The 6 main techniques in autogenic training involve focusing on the following: heaviness, repeating "my arms are heavy"; warmth, repeating "my body is warm"; heartbeat, focusing on the heartbeat and repeating "my heartbeat is calm and regular"; breath, focusing on the breath and repeating "my breath is calm and regular"; abdomen, focusing on the abdomen and repeating "my abdomen is relaxed"; forehead, focusing on the forehead and repeating "my forehead is pleasantly cool." To practice autogenic training, find a comfortable position, close your eyes, and focus on the different parts of your body while repeating the relevant phrases. Start with one area, like the arms, and alternate between focusing on that area and repeating "I am completely calm." Then move on to the other regions. An entire session should last 15 to 20 minutes. Regular practice of autogenic training can help reduce anxiety, depression, pain, insomnia, and other disorders. However, for some people, it may increase stress or blood pressure. So you should check with your doctor first, especially if you have a heart condition or diabetes. Guided imagery and visualization involve imagining a peaceful, calming scene in as much detail as possible using all your senses. This helps shift your mind and body into a relaxed state. You can visualize any calming scene, like a beach, forest, or library. Spend at least 5 to 10 minutes focused on the visualization. With regular practice, visualization and guided imagery can effectively reduce stress and overthinking. Our thoughts, not external events, shape our emotions and behaviors. Cognitive behavioral therapy aims to identify and replace unhealthy thought patterns with more helpful ones. Negative thought patterns fuel overthinking and anxiety. CBT helps address these by teaching you to identify distorted thoughts and replace them with more balanced ones. The premise of CBT is that thoughts create emotions, which then influence perception, beliefs, and behavior. Changing your thoughts can improve your feelings, behaviors, and experiences. For example, the thought "any failure is unbearable and means I'm a bad person" will lead to feeling awful after failure and avoiding risks. The study failure is normal and not the end of the world leads to disappointment but persists. The thought failure helps me learn and grow leads to feeling empowered and trying harder. The event is the same, but the views and outcomes differ. To apply CBT, identify unhelpful thoughts, challenge them, and replace them with alternative ideas that are more accurate and helpful. This process is critical to overcoming unhealthy thought patterns. CBT can be applied to diagnosed anxiety disorders and everyday stress and anxiety stemming from your thoughts. The techniques help you gain awareness and control over your thoughts to cultivate healthier mindsets and less distressing emotions. That covers the main elements of cognitive behavioral therapy and how you can apply its principles to overcome unhealthy thought patterns that contribute to anxiety, stress, and overthinking. The key is recognizing how your thoughts shape your experiences and trying to adopt more balanced and empowering ways of thinking. Cognitive distortions are harmful thought patterns that negatively impact our mental health and well-being. Some common examples include all or nothing thinking, seeing things in black and white terms, overgeneralization, making sweeping statements based on little evidence, internalizing/externalizing, blaming yourself or others inappropriately, favoring the negative, focusing on failures and ignoring successes, emotional reasoning, assuming your feelings reflect the truth. The ABC model can help identify cognitive distortions. It looks at the following: A. Antecedent, the trigger that prompts a behavior. B. Behavior, the resulting action, helpful or unhelpful. C. Consequence, the outcome of the behavior. Analyzing your thoughts and behaviors with an ABC model or dysfunctional thought record can give insight into unhealthy patterns and suggest healthier alternatives. The keys are: notice your thoughts, behaviors, and their consequences. Consider alternative ways of thinking that would lead to better outcomes. Make a plan to adopt healthier thoughts and actions. Practice self-compassion. Change is a journey. Unhealthy thoughts and behaviors often develop to cope with emotional pain or distress. Addressing their root causes with self-reflection and professional support can help establish a healthier mindset in the long run. But in the short term, actively challenging cognitive distortions and making different choices can help reduce anxiety and overthinking. Negative emotions often stem from unhelpful thoughts and cognitive distortions. Keeping a record of your thoughts, feelings, and the events that trigger them can help you gain insight into these patterns and make positive changes. The ABC model focuses on connecting thoughts, feelings, and behaviors. The dysfunctional thought record also tracks thoughts, feelings, cognitive distortions, alternative thoughts, and outcomes. Using either model over weeks of observations can provide enough data to start challenging negative thoughts. Cognitive restructuring involves identifying negative thoughts, determining their cognitive distortions, generating alternative thoughts, and reevaluating the outcome. This can help reduce negative emotions by changing unhelpful thought patterns. Questions to ask yourself include: what evidence do I have that the thought is true? Are there other explanations? What cognitive distortions am I using? What would others think of this thought? Behavioral experiments test stubborn beliefs that persist even after cognitive restructuring. The steps are: clarify the belief, generate an alternative hypothesis, design an experiment to test the hypothesis. For example, the belief everyone hates me could be tested by looking for instances where people have shown they don't hate you. Performing behavioral experiments provides evidence to help change beliefs with an emotional component that won't disappear with rational arguments alone. The overall process is about becoming aware of your thoughts and patterns, questioning them, generating alternatives, and conducting experiments to build healthier ways of thinking that reduce negative emotions and anxiety. With regular practice, these techniques can help overcome unhealthy habits of overthinking and rumination. Here's a summary of the key points. Negative core beliefs and negative self-talk can fuel anxiety and distress. Core beliefs are deep-seated assumptions about ourselves, the world, and the future. Self-talk refers to the constant mental commentary and narrative running in our minds. CBT helps identify and replace negative thoughts with more balanced and helpful ones. Some techniques include thought records, behavioral experiments, and self-scripting. Thought records help catch negative thoughts, evaluate how they make you feel, and find alternative perspectives. They teach you to recognize your thoughts and not just accept them as truth. Behavioral experiments test out the validity of your negative beliefs safely and systematically. There are three main types: hypothesis testing, surveys, and discovery experiments. They provide real-world evidence to challenge negative assumptions. Self-scripting helps you develop an ongoing positive and encouraging inner dialogue. It goes beyond single thoughts and helps cultivate an optimistic attitude and relationship with yourself. It can be used preventatively and in moments of distress. The goal is not to eliminate stress or challenges but to develop a balanced and healthy perspective that is kind to yourself and sees setbacks as survivable. Some anxiety is customary and even helpful. The key is managing negative thought patterns that intensify or prolong distress. With practice, CBT techniques can help transform negative thought habits and foster improved well-being and resilience. But change takes conscious effort and time. Be patient and consistent but also compassionate with yourself along the way. Does this summary accurately reflect the key points outlined in the material? Let me know if you have any other questions. Here is a summary of the key points. Focus on what you can control, not what you can't. Anxiety comes from feeling powerless over things outside your control. Direct your energy to something you can influence. Focus on what you can do, not what you can't. Anxiety involves a lot of abstract thinking and conjecture. Taking action helps bring clarity and empowerment. Look for solutions rather than obstacles. Focus on what you have, not on what you don't have. A positive perspective focuses on resources, strengths, and solutions. A negative outlook focuses on lacks and problems. Look for the positives. Focus on the present, not the past or future. Anxiety dwells in the past, regrets, or the end, worries. Focusing on the present moment reduces overthinking and helps you appreciate what you have right now. Focus on what you need rather than what you want. The non-anxious mindset involves simplicity. Avoid convoluted inner narratives and focus on concrete needs and solutions. In summary, the key is cultivating an attitude focused on empowerment, positivity, simplicity, and living in the present moment. This helps overcome anxiety and negative overthinking. Our well-being and happiness depend more on meeting our core needs than chasing optional extras or wants. Focusing on needs helps reduce stressful overthinking by allowing us to prioritize what matters. Endlessly weighing options and choices may seem helpful but often leads to paralysis and less effective decisions. Identifying our critical needs or non-negotiables helps provide focus and filters out unnecessary noise. Understanding the difference between needs and wants also builds resilience. It's easier to accept not getting what we want when we recognize it's not essential. The attitudes that counter anxious overthinking, flexibility, focus, resilience, and action, depend on mastery over our emotions. We can't push feelings away but must accept them while choosing not to indulge in unhealthy thoughts or behaviors they fuel. An essential technique for improving emotional regulation is the opposite action method. It involves identifying the emotion driving unhealthy thoughts/behaviors, cultivating the opposite feeling for some time, and observing the results. The opposite action method is not about denying emotions but bringing awareness to them and deliberately choosing a healthier response. Applying the opposite feeling, even briefly, can help shift thoughts and behaviors more constructively. An example is responding calmly and validating rather than angrily when provoked. Choosing the opposite emotion, even briefly, often leads to feeling genuinely calmer and avoiding regret over impulsive actions. The initial flush of anger fades, and a sense of calm emerges. In summary, identifying the emotional root cause of unhealthy thought patterns and practicing opposite action responses builds self-mastery and resilience against stressful overthinking. Emotions drive thoughts and actions, so improving emotional regulation is critical. Here are the main takeaways. 2 primary sources of anxiety lead to overthinking: ourselves and our environment. We can be genetically predisposed to anxiety or have developed the habit of overthinking to feel like we're tackling problems. Our environment, including our homes, workplaces, and society, can contribute to anxiety and overthinking. Overthinking has many negative consequences, like physical ailments, mental health issues, impaired cognition, and damaged relationships. It's essential to find ways to manage overthinking. The 4 A's of stress management are: avoid, alter, accept, and adapt. We can avoid or walk away from stressors we can't control. We can alter environments and routines to reduce stress. We must accept what we can't change. And we can adapt to cope with unavoidable stress. Useful techniques for managing to overthink include: journaling to organize racing thoughts, the 5-4-3-2-1 technique to ground yourself in the present using your senses, improving time management through to-do lists, priority ranking, and breaking down big goals, Allen's input processing method to plan how best to respond to external stimuli, setting SMART goals that are specific, measurable, attainable, relevant, and time-bound. Emergency techniques for anxiety relief include: autogenic training using verbal cues and visualization to gain control over thoughts and emotions, guided imagery to visualize a peaceful scene, engaging the senses, progressive muscle relaxation by tensing and relaxing muscles one by one. Cognitive behavioral therapy helps identify negative thought patterns and cognitive distortions, determine the triggers for these thoughts, and develop rational responses and behavioral experiments to change them. The main point is achieving a transformational mindset shift to focus on what you can control, do, and need rather than what you can't, your limitations, and unrealistic wants. Live in the present rather than the past or uncertain future. This empowering perspective can help overcome overthinking and anxiety. Accordingly, there are 5 critical attitudes you need to develop to cope with anxiety and overthinking. Focus on what you can control, not what you can't. Accept what you can't control and move on. Focus on what you can do, not what you can't do. Identify specific things within your control and focus on them. Concentrate on what you have, not what you don't have. Appreciate the good in your life rather than longing for what's missing. Focus on what you need rather than what you want. Meet your basic needs rather than chasing unlimited wants. Live in the present, not the past or future. Avoid what ifs and overthinking by being mindful of the current moment. Book link, click here.